Do you want to
Okay.
kind of introduce, Dave?
Go ahead and do it. You did it well that time.
Hi, and welcome to a conversation that Dave and I have pre-recorded, which is really looking to understand burnout in the context of organizational understanding, individual consequences, and moral leadership within organizations. Over to you, Dave.
Oh, thanks, Gary. So we've gotten to this point. Initially, we were thinking about doing this as burnout as an initiation process, kind of tapping back into ancient pathways of transformation and rites of passage. But in doing this, we also started to come across reference as moral injury, and to look at not just the ways that individuals can transform, but the implication that if individuals are going through moral injury, if they are having a conflict between their values and professionalism with the institutional settings in which they're practicing, that this kind of by implication means that there are failures of moral leadership within the organization, that the institution is set up in such a way that individual professionals are not able to practice the way that they've been trained to practice. And so then we have this question, what's individual responsibility and what's institutional responsibility for burnout?
I think that's a really important point, because if we look at a lot of the literature around burnout, a lot of that literature actually focuses on what happens to individuals and how an individual can avoid burnout in terms of managing self-care. But also what a lot of that research does look at is points to the risk factors around burnout in terms of job organization, high workloads, unmanageable workloads, poor physical environments, poor sense of autonomy, a lack of organizational identity. And many people watching this will be familiar with the list. But what the academic sphere does to a very large extent miss is that the organization provides the job description for an individual, and within that, the organization has a responsibility to manage each of those individual roles in order to avoid burnout. And I would argue that this is where organizations require a high degree of effective moral leadership in order to actually avoid organizational and individual burnout. And I think we need to ask questions around not only the role of clinicians in understanding this process, but I think we also need to recognize that particularly healthcare organizational leadership in terms of chief executives actually have very short periods of tenure. And it's recognized in the UK that the role of a UK NHS chief executive can be as little as 2 to 3 years. And yet nobody seems to question why. And, to you and I, the reason for that would be fairly obvious. These individuals get burnt out. So actually, the economic and social cost of burnout is enormous. And it's a conversation that we need to effectively begin to have across the board.
Right. And so if we shift, right now with the focus on individuals, on mindfulness and self-care and time management, really this is, instead of looking at the frontline professionals as weak links that need to be reinforced, we can look at them as the canary in the coal mine. They're the ones who manifest some of these problems within the system first. And so rather than looking at it being an individual frontline physician problem, we start to look at what's the structure of the institution that's creating burnout in our frontline staff, but then also, as you're pointing out, in the top executive staff as well. So
yes.
Instead of this getting pushed off to individuals doing meditation, how can we look at it as what kind of institutional changes need to be made to support everyone within the system?
I think that's a really important point, and I think what healthcare organizations need to start to manifest is effective moral leadership, effective leadership through all sectors of the organization. And that's not just managing KPIs, it's not just managing adherence to a set of internal SOPs. It's actually effectively creating a healthcare organization that can function with the aim of taking care of the people that it's supposed to take care of, i.e., patients. But within that context, for doctors and nurses and allied healthcare workers to be able to effectively take care of patients, they also need to be effectively taken care of as well. And I think one of the complexities of modern healthcare environments is that there is an increasing wariness and risk of complaints and investigations, and organizational responses to that is increasing rigidity around the way the organization manages its staff and its workforce. And I think that is actually contributing to the overall process of actually how and why workers are getting burnt out. And we see that across the board. So it's how we can actually create an effective leadership to effectively morally lead an organization forward so that it's able to better manage taking care of everybody within that organization.
Mm-hmm. Yeah. And, kind of going back to initiation, one of the requirements for initiation is a community of elders who can help guide people through the process, the difficult process of initiation. And so one of the structural things we have in healthcare now, everyone is really isolated, focused on their computers, and they're so busy doing all this time on the computer, there's no time for any interaction. There's no like doctor's lounge like there used to be back in the old days. There's no place where this happens just kind of automatically, where you have elders and having time together where it can be supportive. And so that's a question I have, is how can we create a healthcare system in which support is built in a way that feels genuine? What are your thoughts with that, Gary?
I agree, and I think we should be heading towards understanding that the role of elders is really important. And if we go right back to the ancient tradition of healing, healing was seen as an art that was communicated from a skilled educator and teacher through the process of an apprenticeship.
Mm-hmm.
And it was that process of leadership, of passing down of the art of healing, that I think modern medicine is actually losing in terms of training programs are now fairly rigid in terms of their scope, in terms of the syllabus, and there is limited recognition of the expertise of an individual. And with an increasingly rigid adherence to a biomedical framework, what we miss is the psychosocial spiritual context of the healing framework, because those components of the framework are much more difficult to rationalize in the context of high-level multi-systemic reviews that create best levels of evidence, but those best levels of evidence actually ignore the expertise of one individual who might be able to solve the particular problem of a particular person sitting in front of them. So it's about creating a shift in order to understand that. And ultimately, that actually rests on effective moral leadership of a healthcare organization, both for administrative leadership and clinical leadership, and a recognition that true moral leadership is about leading for a higher purpose and about instilling and inspiring in the workforce. And I think, if I think back to when I was training, I could name any number of senior clinicians and also senior administrators who were incredibly inspiring individuals. Whereas if I look to current peer groups, do I see that same level of peer inspiration? Probably, sadly, not, because we're all reduced to following the standard regime for the treatment and management of anxiety and depression or schizophrenia or whatever it is. But it's a regimized system of care, which, yes, has benefits, but when we stick to a regime systemized level of care, we also miss the fact of how to treat an outlier. And human beings, by their very nature, are individuals, and we need to be able to respond to that individual need, whether it's within a patient, whether it's within a clinician or an administrator. We need to be able to move beyond that.
Yeah. Yeah, I mean, there's a lot of things in there, this idea that a focus on us being solely technicians rather than healers, and a focus on quantitative analysis and quantitative measurements may be missing out this principle of caring, which is qualitative. Standardization is about objectification, and caring is about subjectification, about subjective relationships. And so by ignoring the subjective and the qualitative and the caring, actually, in healthcare, it's rippling throughout the whole system, where everybody is working like mad to be more efficient, and 50% of physicians, surveyed will report symptoms of burnout. So the system itself is creating this burnout. And then the question is, how can we bring this caring back in? And I think you're pointing to some of it, of, how can we allow people to use their individual expertise rather than just relying on protocols? So yes. Is there a way to have qualitative, like a focus on qualitative time? Or I wonder about this sometimes, like, do we care for people because there's good evidence that that's what creates good outcomes, or do we care for people because that's the right way to treat human beings? And I think that's where we get to moral injury and moral leadership, which is, do we do things because that's the right human thing to do, or do we only do things because we've got numbers to back it up?
I think that's a really good question, and I think that's a good point to end this conversation on, because it raises a really important topic for our listeners, in that how do they feel they can respond to this, and how can they take this forward in terms of their own individual practice? Are you willing to be a healer in the true context of healing by human compassion and understanding, or do you want to be a healer by numbers? And I think that is an individual question that ultimately rests on an individual's understanding of their own moral standards.
Yeah, I had this realization recently. How many of your important human relationships are numbers important in? When you think about your mother, your father, about your partner, about your siblings, how much do numbers play a role in important human relationships? And I would say little to none, that they're abstractions. Numbers are abstractions. They're not human relationships. And that may be the fundamental flaw, that we're basing medicine on numbers rather than on human relationships.
I think that's a really good point, and much appreciated for this conversation, Dave.
Yeah, thank you, Gary. Hope to continue it.
Right, should we stop recording there?